Good morning and welcome. Thank you for gathering here this morning. When I first signed Medicaid expansion into law 4 years ago, alongside so many of you that have joined us in this room, I said it was because of the efforts of those who determined that this is too important to let the challenges obscure the real opportunity for our state. I said that lives would be changing and that lives would be saved for our friends, our family, our neighbors, the folks that we see in the grocery store and go to church with, Democrats and Republicans, rural and urban. And when I stood before the legislative body and delivered my fourth and final State of the State in January, I asked that we not forget exactly what Medicaid expansion has done and will continue to do for the state of Montana. I asked that we again come together as we had done in 2015 and not let partisan politics get in the way of protecting the health care of our neighbors. I asked that we preserve what had literally saved lives in Montana. What had kept and has kept the doors of our rural hospitals open. Not one single rural hospital has had to close their doors in Montana. And that's helped keep those rural lives open. When I stood before the legislative body in January for my fourth and final State of the State, I asked that we continue what has been really the greatest jobs bill that we've had in our state, what significantly dropped our uninsured rate in our state and also lowered and reduced uncompensated care costs. I asked that we continue what has given Montanans health care, both physical and mental, that allows them to work and not be one medical bill away from bankruptcy. What's provided the security and the access that every Montanan deserves to have. I'm so pleased to be here before you today, knowing that we're preserving all of this and indeed more for Montanans. Putting pen to paper is a testament that our state and its people are better off. Better off because of Medicaid expansion. It's a testament that we did again come together in recognizing that no challenge is too big to obscure a great opportunity for our state. So thank you to all of the people that did the work, who put your heart into this fight and worked dang hard to make sure that we could celebrate today. Thank you to Representatives Ed Buttrey and Mary Farrow for their leadership and their tireless efforts to get this bill to pass. Thank you to Senator Jason Small for not giving up and getting this bill through the next step as well. Thank you to all the legislators that are gathered here today in this room that worked damn hard to make sure that Montanans had health care. And thank to all of the rest of you gathered here and in every corner of the state that worked hard, who talked to legislators, who organized in communities, who underscored the importance of health care to make sure that this could happen today. Thank all of you for your efforts. I'm also pleased to sign just not one, but 9 bipartisan health care bills today. These priority bills work together to protect the progress our state's made in recent years to provide quality and affordable health care to all Montanans. They'll further our efforts to increase access, reduce costs, and improve the quality of care. Things like lowering insurance premiums on the individual market by as much as 10%, improving access to care in rural communities and in our tribal communities, and to mental health and substance use treatment. Bills that protect consumers and rural pharmacies from bad actors in the pharmacy benefit manager industry, and continuing our efforts to prevent suicide with community-based solutions. These are all important steps we're taking to improve our healthcare system. And these bills have been backed by a broad range of patients, providers, businesses from all across our state. They are carried by Democrats and by Republicans, with bipartisan support all along the way. And while the bills that we'll be signing, the additional ones, don't necessarily represent nearly all the progress that we made in this session alone, even on healthcare, they show what can be accomplished when we're committed to working together to do good for Montana. They show what can be accomplished when we find common ground. When we take much needed action now to reform our healthcare system, having a positive impact for years to come. Here in Montana, we continue to be the example for other states to follow. So thank you again, not just for being here, but for all of the good work over these past months and indeed years to get these bills to my desk. Now let's sign some bills. I'm going to start with House Bill 658, Representative Buttrey and Farrell. We'll do it. Picture afterwards, just because you so many people. So the first bill signed is 658. As I noted, we're certainly making sure that all the progress in Medicaid expansion that was made isn't lost. Touched on that in my remarks, but also wanted to add the bill also provides $3.5 million in funds to build on that successful HealthLink program, to try to make sure that we're providing individuals on healthcare an opportunity to actually increase their opportunities. Representative Buttrey, then Representative Farrell, things you want to say?
Thank you, Governor. And we call this Act Maria the Medicaid Reform and Integrity Act, and it's truly an innovative and conservative solution crafted by Montanans. And I think, like the original HELP Act that we passed in 2015, will likely become the model that many other states are going to look to follow. I do want to thank the Governor and his staff for all the hard work and the many solution-minded legislators that are here that put extreme ideology aside and helped to craft and ultimately pass this law for the good of all Montanans. We truly put Montana first. And I think that's what the people of Montana sent us here for, and I'm really thrilled to have been part of the process and to work with the many folks in this room to get it done. Thank you, Governor.
Thanks, Representative. It isn't mine. I suppose so. How could I tell you otherwise? What a long, strange show it's been.
It's with a very grateful heart that I stand before you today. I have a few thank yous. There's tons of thank yous we could do, but I'm going to narrow it to a few. I'll start with the people of Montana. Thank you for your effort to continue access to health care for nearly 100,000 Montanans. Thank you for your courage and your willingness to share your personal positive impacts through stories, your life-saving stories, and literally thousands of contacts with legislators through emails, hours of testimony, et cetera, phone calls. Thank you. Without your work, we would not be where we are today. And because of your perseverance, strength, and commitment, we will continue healthcare, access to healthcare for over 100,000 Montanans, or nearly 100,000. Thank you to the healthcare community. All of it's important, but I want to take this opportunity to thank hospitals in particular who were vilified during the session. Contrary to popular belief, buckets of money don't magically fall from the sky into the hands of hospitals and other healthcare providers. But what does happen is providers get paid, in many cases, to provide a life-saving care. Just ask the over 100 women who are currently being treated for breast cancer. Just ask the over 1,000 people who possibly have avoided colon cancer. Or ask our Native people who, for the first time in our history, have access to a real healthcare system rather than just life and limb. Ask the veteran who suffers from suicide and mental health issues. Ask them what that care means. And ask the farmer who had a heart attack on his tractor, but thanks to a healthcare provider was able to access healthcare at a rural hospital and have their life saved. It's real simple. Without healthcare providers and hospitals, there'll be no care. Another thank you. Thank you to the voters of Montana. As Representative Buttry touched on, and the governor, I want to thank the voters of Montana for sending common sense legislators to Helena. Common sense legislators who prioritized you, Montana. They prioritized you. And they put partisan politics and personal gain aside in order to solve some of Montana's most critical problems. This is not controversy. This is collaboration and common sense. Nearly 10,000 jobs created, hundreds of millions of dollars into the economy that wouldn't otherwise be there in all four corners of the state and all parts in between, supporting small business and, most important, supporting the health and well-being of our state. That is common sense, it's collaboration, and I want to thank the voters for sending enough of the right people to Helena to get it done. Last, let's talk about who has access to health care thanks to this life-saving program. I want to put a real face on the issue, a reality dose. My new friend, Gary, and his family, they are not the exception to the rule. They are the rule. 7 in 10 Medicaid members work. 8 out of 10 come from homes where there's a working family member. And this family is no exception. Gary and his wife both work. But like most Medicaid members, they don't make enough money to pay for insurance. Medicaid has been a life changer for Gary and his family, allowing their child to hear thanks to hearing aids, allowing them to go see the doctor and still pay the bills, allowing his family to buy a home. Thanks to access to health care, Gary and tens of thousands of other Montanans work and are creating upward mobility for themselves, generational change, participating in the American dream. This has been a game changer for Gary and his family, and like I said, tens of thousands of other Montanans across our state. I'll close with this. One of the most important thank yous for me is to my colleague, Representative Buttry, for bringing the solution forward and putting the health and well-being of all Montanans first. Thank you.
I was just making sure that I knew what the date was.
And I know that there's a bunch of people that want a Medicaid picture. Because of that one, we'll do that at the end after we're done with the rest of the bills. So first one will just be the legislators.
Am I close enough?
Medicaid expense is now reauthorized.
So legislators, we're going to come up after everything's done and have a picture, so please hang around. Steve?
Sounds great. The next bill is Senate Bill 125, lowering health insurance premiums. Senator Fitzpatrick, thank you for being here. Briefly, across the nation, in response to rising health insurance premiums and markets unsettled as a result of federal action, a handful of states are actually using public reinsurance programs, which is creating high-risk pools to lower premiums. As of today, only 7 states have implemented reinsurance programs. That's Alaska, Maine, Maryland, Minnesota, New Jersey, Oregon, and Wisconsin. Montana is now the 8th. I'd like to thank certainly the bipartisan work group that was led by Department of Administration Director John Lewis, had participation from the State Auditor's Office, health plan representatives, our members of the legislature, including Sales and McNally, consumer advocates. I'd also like to thank Jess Rhodes in my office, who did an incredible amount of work on this to make sure that this happened. Montana will submit a waiver to the Secretary of Health and Human Services by July 1st, provide the opportunity for tribal consultation, public comment, public hearing. New rates, which could be up to a 10% reduction, will take effect in January of 2020. Senator Fitzpatrick, thank you for carrying this. Is there anything you'd like to offer?
I would like to thank you, Governor. I think this is one of those bills where we can look back and say this is how the legislature should work. This was a bipartisan effort, Republicans and Democrats. I think
That's what happens when you bring your dad.
All right.
Sorry.
I think I want to thank the governor. I want to thank the commissioner for bringing this to attention. I think you did a great job. When you look at this bill, it does a couple things. Obviously, it helps lower insurance costs, but the other thing it does is it prevents a collapse in the individual market. If that happens, we could have costs spiraling out of control into other areas as well. So I think this is very important. Again, I want to thank a couple people, obviously the governor and his staff, the commissioner, Representative Butchery, Representative Moore, and Senator Thomas. They were all tremendous advocates for this bill, and I appreciate all the work they did.
For these bills, are you doing two rounds? So anybody else that worked on 125, go ahead and come on in.
Is there the insurance question?
We have some folks on this side as well, please.
Round it out.
Yeah, is there an AARP? Are there people here for AARP?
Batista.
Very good. They're text too.
Many of us. Yeah, you can actually be behind us like this. No, yeah, can't do that.
1, 2, 3.
Perfect. Great. Thank you all very much for your hard work. Yeah. You stay here. We have 3 prescription drug bills that we'll be signing today are 3 bills relating to prescription drugs. Senate Bill 335 protects federally qualified health centers from discrimination in prescription drug pricing, which will also help to protect access to low-cost drugs by applying strict protections from certain pharmacy benefit manager billing practices. And Senate Bill, no, I'm sorry, that was actually messing the two of them up because you have 2 of the bills here. 335 has to do with federal qualified health centers, also help to protect access to low-cost drugs for low-income and underserved Montanans. And Senate Bill 83 gets the problem of surprise fees charged by PBMs. Bill regulates PBMs directly by applying strict protections. Again, Senator Fitzpatrick, thank you for carrying 335 and 83. Anything you'd like to offer?
Sure, I think these are two very important drugs for people who purchase prescription, or two important bills for people that purchase prescription drugs. First one, Senate Bill 83, it does a couple things. I think probably the most important thing for consumers is it stops the practice of requiring a pharmacy benefit manager. They require pharmacies to charge copays greater than the cost of the drug. We heard testimony down in committee that people were paying $250 when they only needed to pay $50. So that's very important. I think the second part is that it protects our local pharmacies, ensures we have access to drugs in rural areas. There are many, I think, predatory practices by pharmacy benefit managers towards your local pharmacy, and this ends many of them. That way people, especially in rural areas, will be able to get the medicine they need. Senate Bill 335, this is one really about protecting the taxpayer. What this does is it allows pharmacies that are 340B pharmacies, these are pharmacies that give discounts for drugs for Medicaid and Medicare patients, to be able to keep those discounts. Those medicines then can be sold at lower cost to people out who are obviously Medicare and Medicaid patients and buying those drugs. Very important. Again, we have pharmacy benefit managers trying to take those discounts, take those benefits of that 340B pharmacy program. So again, two important bills, and I'm very pleased that the governor is here and signing them as well. A couple people I'd like to thank on Senate Bill 83. Representative Butcher, he helped carry it. Senator Thomas was a tremendous help, and so was Speaker Hertz over in the House. And then on Senate Bill 335, Representative Lentz was a carrier, and he did a great job in the House for it. So thank you very much.
Great, absolutely, Senator. I'd also note one more bill that we're signing. Senator McNally couldn't be here today, but she sponsored the Prescription Price Protection Act, which was Senate Bill 270. This bill was one of our administration's priorities. Prohibits pharmacy benefit managers from actually requiring pharmacies to charge consumers more in co-payments than it would actually cost to make the drug. So it's another important bill. Really appreciated Senator McNally's leadership on this. First, we'll sign 335. Did you have anybody that you wanted in on this one?
I think some people want to get it.
Yeah.
Primary care center.
Any 340B pharmacies interested in that?
Yeah.
Good job with this. Yeah.
Thank you, Stuart.
It's like you're combining monsters, and then they put home all the hard work. Good work, for sure. Yeah. Oh, 83 still, too. Yeah. Did you have folks, Senator Fitzpatrick, that you wanted for 83? No. Do you want the pen? You're like, it's like the Oscars. You just keep collecting more and more. Riley, did you want to take one just for fun? I want to see all of these on your refrigerator. Okay. Thank you very much. Yeah. Thanks. I assume we're doing one at a time. Yeah. Here are a number of bills that actually increase access to medical, mental health, and substance use treatment in both rural and American Indian communities. I'll first welcome Representative Crowder. Oh, and Senator McClafferty, fantastic. So this is House Bill 660, and what it does is set up mobile crisis team units to improve rural communities' ability to respond to mental health crises. I thank both the members of the Governor's and Mayor's Challenge Suicide Prevention Group and the Veterans Administration for the work that they did to bring this forward. Representative Crowder, anything you'd like to say?
Thank you, Governor. This bill is about partnering with our local communities on the mental health challenges they're facing and delivering help to people in need when they need it. This will reduce human tragedies and it will reduce cost on law enforcement, our hospitals, and our criminal justice system. So this is a win for all Montanans. I want to thank the governor and his staff, Senator McClafferty, Representative Jones, Representative Dunwell, and all the other co-sponsors and all the proponents for this bill. And I'm so glad that we're moving forward with this.
Senator McClafferty.
Thank you. This bill is possible because of a lot of people doing a lot of hard work. And I want to thank Representative Crowder for carrying the bill for us. When we approached him to carry it, he saw the importance and the need of it, and he jumped right on board. And everybody who testified for the bill, I'd like to thank him because, you know, it takes a village to make something like this work, and it will benefit all the people of Montana. So thank you.
Thank you. How many bills did you get signed this year?
Well, this will be the second. Yeah.
Fantastic. Not bad for a freshman, right? Is it one? Oh, sorry. Anybody that would like to be in this one?
All the governor's challenge and mayor's challenge folks.
Yeah, that'd be great. Twice in.
So 2 in 1 day.
I tell you. Come on up. Pretty good, Sheriff. Thanks. How are you doing?
Nice. Could condense a little bit, 2 more folks.
Take 2 rows.
All right. Perfect.
Have you been happy to be home?
It's been a while to use this.
Just kind of, it's like,
It's like reverse culture shock. Yeah.
I can only imagine. I'd say it, I've been missing you. Thanks, Paul, for sure. Yeah. Yeah, good work. Next, I'd like to welcome Senator Jen Gross for Senate Bill 30. Session, we're also making substance use treatment and mental health care more accessible with Senate Bill 30, which adds peer support as a Medicaid covered service. This bill had a few lives, but we're here today. Senator Gross.
Yes, thank you, Governor. So this is a bill that's going to provide very much needed services for folks struggling with addiction and mental illness in our communities. And I think we'll really grow the workforce of providers so that folks in all of our communities can access these services. The bill did originate with the State Tribal Relations Interim Committee, and I think it's really important to not lose sight of where that bill came from, and is rooted in reducing recidivism and will help address inequities in an Indian country. There are too many people to thank. The governor is right. We did. It was an uphill battle to the very last day of the session with this bill, but I'm very excited to be here today and so incredibly grateful to everyone who supported us in this effort. Thank you.
That's what matters, right? Anybody else want to come in? There are a few folks.
There are.
Well, I thought you were the one. Oh,
You didn't get the memo. 1, 2, 3, look over here. Perfect. Jen.
Jim. Don't lose that. I'd like to welcome up Representative Jonathan Windyboy. All right. Did Senator Small help out on this one too?
Thank you. If it wasn't for him in the Senate,
Seriously. I guess I'll give you chairs then. So House Bill 599 ensures that tribal communities who wish to can license and use community health workers in Indian Health Services facilities to improve access to care. Representative Windyboy would like to say anything.
thank you very much, Governor. CHAP, which is acronym for Community Health Aid Program. This has been in federal law for a couple of decades, but once again, as Montana, with the leadership of the governor, that Montana is the third state in the country to implement CHAP, but what is being signed today is light years ahead of Alaska, as well as Washington, who also have this in place. This is going to have an impact on Indian country in Montana, as the ACA did across the country. The tribes' Indian Health Service programs will triple their third-party revenue, and as well as also have the ability for the dental health aid technicians, behavioral health aid technicians, mental health aid technicians, and how the behavioral health will help the PTSD and veterans. Mental health will also assist in suicide prevention. So the possibilities are endless with this. And so I want to thank everybody. I want to thank all of the both chambers who have stood with us, even though we had a lot of opposition. And I also want to give my hats off to my colleague over, Senator Small, because if it wasn't for him in the Senate, this thing probably would have died. If you wouldn't mind giving him a few words.
Of course. Senator Small.
Like you said, this was one of the harder bills to actually pass. It made Medicaid seem fairly easy. I'm not sure why that is. Yeah, so as Representative Windyboy said, this is going to be a huge benefit to Indian country. I'm glad we got it done, and it's one great opportunity. Thank you.
All right.
Perfect. Did anybody want to get in on this one? Good.
Come on up. And also too, I want to, Governor, I also want to present President Work. If it wasn't for him, in Fort Belknap, for pushing this issue, it'd be impossible.
I heard
A few more folks on this side would be great. Take 2 rows.
They're kind of got to get sort of close. Make it like a grade school picture, a couple rows or something like that. We'd hate to cut out your beautiful faces. Got to keep squeezing. You can make a human pyramid.
Your shoulder.
Yeah.
1, 2.
Oh, no, wait a minute. Okay, there you go.
Great work, my friend. Absolutely. I'd love, yeah, I would love. Absolutely. I would like to welcome Representative Karshala. So this is House Bill 696, which provides grants for suicide prevention work by the Native Youth Suicide Prevention Coalition and the Governor's and Mayor's Challenge Suicide Prevention Initiative, focused on service members, veterans, and their families. And thank Representative Karshala for not only the work that she did this session, but we did a lot of work last session as well. And this is an area where I think we are making a difference at the state level, and it's something that we need to continue to work on. Representative Karshala.
Thank you, Governor Bullock. I think first of all, I'd like to thank our service members and our families. They've sacrificed so much. I think the least that we can do is provide them the care that they need. Montana was selected as one of 7 states nationwide to participate in the Governor's and the Mayor's Challenge. This is quite an honor, but this also speaks to the significance of the problem that we're facing. Montana has one of the worst suicide rates in the nation, though we are improving, but our veterans commit suicide at twice the rate of other people. So we've got a lot of work to do. It's an opportunity. I'm looking forward to working with all of the providers who've been making progress. We are making progress. We are improving our suicide rates. So I want to thank the providers also, but I also want to thank the Department of Health and Human Services because they're doing fantastic work. The Governor's office has done fantastic work. I see a lot of folks in the room who've really taken this on and made a significant impact in our suicide rates. So the thanks go to all of you.
I imagine there are people that would like to join.
Hey, how you doing? I've missed you. You gonna stay that show?
So close.
It's about time.
Great.
I can like Lisa sometimes. Yeah. I think just about, I don't know that I've never known. So you're doing okay. Well, come on.
You got everybody in, Riley?
Yes, we do.
Fabulous.
Not yet. All right, 1, 2, 3.
So next we'll get everyone here for Medicaid. We'll do a bigger picture.
Thank you. So Medicaid expansion, do we still have Butchery Farrow? Representative? Sorry. All right, my friend.
Yes.
I always thought we called it Shaw, not Maria. You remember when we called it Shaw, not Maria?
All right, if you're coming for Medicaid, we're going to take a picture quick.
Sherry, thank you. I haven't actually seen you smile.
If people want to kneel on this side.
Feel a little sore.
You guys aren't going to be seen, so you'll have to just like to the carpet. Where are you at?
Hold still. All right, no blinking either.
All right, let's try that again. Are you going to put the pen? Can you get it?
This is big. You could say that. This is a big, whatever. Big deal. No. Camera might catch you.
Great.
Refreshments in the governor's office immediately front.
Cake and tea. Oh,
All right.
you want other stuff?
No.
All right, big smiles.
I don't even remember what Shaw stood for.
You guys can smile when the session's over.
It was saving health care for all workers. Workers.
Yes.
There you go.
Good deal. That picture taken.
Yeah.
Down we go.
Thank you again.
Thank you, Governor. I'm really excited to be having Senate Bill No. 14 signed into law today. I want to thank the Attorney General and his staff for bringing the bill to update our criminal stalking codes so that we can protect vulnerable individuals, hold dangerous offenders accountable, and just bring the statute up to date so that we can have we need survivors, not victims. So thank you, Mr. Attorney General, thank you, Governor, and thank you, Deputy Attorney Anna Savarud, for your work on the bill.
Sure, so thank you, Governor. I want to thank Anna Savarud and Mary Kokenauer in our office, two dedicated Assistant Attorneys General who made it a point to draft a really great bill. I want to thank Senator Gross for being passionate about keeping our community safe and carrying this bill. And I'd like to thank Representative Carl Glim, who was the House floor sponsor for the bill as well. Great work, and thank you, Governor, for signing this bill.
All right. Photo. Perfect.
House Bill 578, Representative Buttrick.
Want me to speak on it?
Yeah, only if you want to.
So this is just for disability surplus lines of insurance, an important bill to fill a hole that we had lacking in Montana. And we had a lot of good support from folks interested in it, and our good lobbyist, Bill Warden. Thank you, Governor.
Good.
Great lobbyist. Great lobbyist.
1, 2, 3.
It's not. Not at all. Talk about this little frogs there. Thank you. Congratulations. Thank you. Congratulations.
Thank you, Governor. House Bill 656 is an important bill because it brings more oil and gas money back to eastern Montana communities where the impacts are felt both for public safety and infrastructure. This bill has been a priority for me, and I'm glad to see a victory for my district and all eastern Montana communities. So thank you, Governor, and everyone that helped make this bill a reality. Thank you.
Joel, your tails.
Oh. Okay.
There you go.
Thank you.
Because you know, Eastern Montana is doing
Yep, it is. It really is.
We don't.
1, 2, 3.
Perfect. Well, I think the good mayor and others would like to get in.
Mayor, you want me to east? For the east.
Thank you.
Yeah.
Fund a lot of good programs.
You bet.
Oh, I know them. I know.
There we go, a little bit more. There we go, perfect.
Don't be crooked.
1, 2, 3.
Oh, sorry. Was that good? Of course I know you did.
Well, you did it up there and just actually saying, we gotta address something on our own. So, hold on a sec. You each deserve it. Good work. Absolutely.
House Bill 41 is the language immersion projects in public schools. It's an extension from when it first got implemented in 2015. And so far to date, Crow and Blackfeet is implemented. We have enough funding in there to start up 3 more programs in language immersion. And I want to turn over to Box Elder has a language immersion. I want to allow my little sidekick here to say a greeting to everybody.
Don't say.
One more time.
Don't say.
Good job.
Smile big.
Are you smiling?
House Bill 756, Representative Richard Smith, tell us about it.
Governor, hello. This is in honor of Dolly Smith Akers, or Dolly Smith Cusker Akers. She was the first Indian woman state senator, first tribal chairman for Fort Peck tribes. She has quite a colorful history. She was impeached, but Nixon reinstated her. And she worked with Eisenhower, my favorite president. Anyways,
She had to have the same spunk as our representative.
Wow, that's a lot, isn't it?
It is.
You want to say anything?
I just want to say that it was, it came on our transportation committee, and this was one of the priorities. Once we heard the story, we proceeded willingly.
Senate Bill 264. What is it?
It's a good bill, it kicks ass. So what Senate Bill 264 does is it sets prevailing wage through the end of remediation for a coal-fired power plant. And what it's going to do in the long run is it's going to affect Colstrip. It's going to make sure that the craftsmen that work there now are going to be able to continue to work there and get paid a good high wage. And you know, it's going to keep people at home, and that was my intent with the thing, was I wanted to just be able to keep people at home working, give the guys who started the plants and the mine, you know, the plant down there, the opportunity to finish the job, and that's what we're going to accomplish with this.
The finishing the job will be the cleanup and remediation at some point, prevailing wage, great. There may be a few people that want to join this mission.
This one.
Good, how are you?
You guys clean up so well too.
That makes me nervous. That makes me nervous with you. What's better? Come on up here, boys. Don't hit that camera. What is your voice?
Can I get a few more folks to the side? Scooch a few more feet over. There we go. Perfect.